While we have various solutions in the past, they're fragmented in their integration and the ability to communicate with our electronic medical record as well.
In the past, we had a solution, but you had to log in separately to that solution, and it just isn't nearly as effective or efficient to be working out of two systems.
We had a different reminder system previously that we utilized that did not link up with Meditech.
When patients wanted to register or come in or schedule, they would have to call. And then when they came in, they had to do everything on paper. They had a clipboard. It was just awful. But with Luma now, we are able to schedule them, send them a link to get all of their documentation signed, and remind them that they have those appointments all at the same time.
One key point to the Luma selection was your integration with Meditech.
The fact that it links with Meditech and cancels appointments and utilizes the waitlist has been very beneficial.
When a patient cancels an appointment, that writes back right into Meditech.
We could buy this and buy that from this place and that place and have dozens of integrations, or we can have a one place that not only solves all of them, but is speaking the same language from the same point.
I hope our staff, as we have implemented Luma products, have seen that our focus has been on creating efficiencies for them. We have looked at solutions that hopefully take some of the mind-numbing work away from them and have allowed them to actually focus on the patients when they walk in front of them.
Trust the experts, not just the experts at Luma. Yes, trust them because this is their product, but also trust your boots on the ground. Trust those people who it's their job every day in patient care. Make sure you're bringing everyone to the table and it's the right people at the table at the right time.